This podcast represents my opinion and the opinion of my guests. This is not medical advice, and I am not establishing a patient-physician relationship with any listener. The content here should not be taken as medical advice. The content here is for informational purposes only, and because each patient is so unique, please consult your healthcare professional for any medical questions you may have.
Welcome back, everyone, to another episode of the Not Your Doc podcast. I'm your host, Vanessa, here with producer Seth, and we are back again with Mr. Not Your Doc himself, Dr. Charles Tadros.
Hi, everybody.
Chucky T.
Yeah, thanks, Seth.
In the
Hi,
house.
Vanessa.
Chucky T in his own house, actually.
That's right.
In the Midwest Institute for Hearts and Minds Studios. Okay, so this is my second episode back after maternity leave.
Yes.
And of course, this is another topic born from my, recent experiences as a new mother and a patient, of course, in healthcare. And my son, of course, is a patient as well, and I have to make decisions about him. And so I think this is going to be a really relevant topic to a lot of people today, because there is so much information out there about how to make good decisions about your healthcare, and there are also a lot of opinions about what are the right decisions for healthcare. So today the question is, trust the experts? Question mark. How to use healthy skepticism to make the right choices about your health. So first of all, what do we mean when we say healthy skepticism? I mean a critical eye, I suppose, or a critical ear when somebody is making a suggestion or a recommendation. And when I say critical, I mean examined and thoughtful and analyzing. Not critical as in, I don't like your haircut.
Not just an opinion.
Yeah, not just an opinion,
Right.
but kind of an analysis, maybe. What do you think of when you think of healthy skepticism, Dr. Tadros?
Well, I mean, everything from an opinion, which during this pandemic, I think a lot of opinions were expressed.
Sure.
But part of it is just a way to say almost every field. There's some fields are much more set and sure. That's why engineers like their field. It's all numbers out to the 10th digit of specificity and accuracy, but also that there's conflicting data, and I think that's where people get their healthy skepticism.
Right. I think there's sort of this like spectrum that a lot of people, that everyone's sort of falls on in terms of how trusting they are. Right. We've got all the way on the left is the tinfoil hat society that everything is a conspiracy and you're being lied to. And then all the way on the right, we've got sheep, right? That need a shepherd to lead them, that just blindly follow everything. So we want to fall somewhere in the middle of that spectrum, right?
I'm full foil hat.
Okay, all right. Well, Seth is going to make his decisions that way. Yeah. We're gonna try and give some people some suggestions on how to feel confident in the decisions that they're making, right?
Think about how you're thinking. I think that might be a better way of saying.
I don't want people to know what I'm thinking. That's why I wear the foil hat.
Exactly. So, well, that's another episode, folks. We'll talk about tinfoil hat building. Yeah. Okay, so I think this has come up for me recently in having to make healthcare decisions about my son.
Yep.
So, when you have a child, there are a lot of decisions to make. Boys get circumcised, to circumcise or not to circumcise. There are vaccines. There are, just all different kinds of healthcare screenings that are recommended and important. And sometimes it's hard to feel like you're making the right decision. Obviously, a big part of making good healthcare decisions is having a relationship with a doctor that you trust that is qualified, right? So, that's kind of like an overarching statement here that we have always valued, that people need to have good healthcare relationships, good primary healthcare They need to see good specialists. They need to have a trusting, open relationship with their healthcare providers. So that sort of sets the stage for good decision making, right?
That's part of it. That's certainly part of it. There's a lot of stuff that comes before that, but yes, that's the ideal setup. That's correct. Yeah.
Right. Okay. So then, when you're faced with a choice about healthcare, I think it sort of breaks down into two parts. So there's sort of like preventive care that is, a list of recommended, whether it's screenings or vaccines or blood tests that are recommended at specific ages. That's sort of one group of care. And then the other group of care is treatment for an actual, a symptom, a concern, a condition, a diagnosed disease. And there's a process that is healthy to go through in order to make the best choices about that. How do you feel like I'm setting this up correctly?
Yeah, I can take the perspective of specialists. You're the new mom, the new patient, with the new baby. Absolutely, yeah.
Right. So, okay. So first of all, let's. How should we frame this up? I think that a good way to frame this up is let's say circumcision. Let's say my question is about whether or not to get my son circumcised, right? Okay, so I can come into it with my own beliefs about what's traditionally done in my family, what we'd prefer to do for my son. But I have a lot of questions about how does the procedure work? What are the different types of procedures? Is it going to hurt? What do I need to look out for? What are the risk factors? So I might ask you as my, child's pediatrician, what do you recommend?
Yes.
And you're going to give me a recommendation based on what?
Yeah, so that's a very good question. So a lot of, if it depends on a variety of things, but I think most physicians would ask, first of all, number one, it's oftentimes already scheduled to talk to you. So it's already predetermined while you're in the hospital oftentimes with the new baby. Not always, but oftentimes with the new baby. It's already kind of scheduled that during a certain visit that this will be brought up. You could have certainly talked about this in advance, especially if you've had other children and you already know the pediatrician. But sometimes this is the first time you'll have a chance to actually talk to the pediatrician about it. So sometimes it's that sense of urgency. I got to get, the insurance will pay only this time, or it's going to hurt more if we do it later, or everybody's asked me to do it now and not to delay, but I'm not so sure. So that sense of urgency. So sometimes if you have time to think about it, or time to question, or time to check out different sources, reliable sources, that's great, because even if you've done legwork beforehand and kind of have a list of questions, sometimes the doc or you're not quite, you're just a little baby. You may not want to sit down for a 15-20-minute discussion about these things. And sometimes the doc is like, hey, they're seeing 3 newborns and they have to go back to the office and see 40 children. So sometimes it's not quite. So if it's not a pressure of time, which is a key element, I think that's extremely important. So if that's the first thing. Number 2 is if you've already had a chance to talk either through patient portal or other way to talk with the professionals that you're interested in their opinion, or expressing your opinion or your questions. I think sometimes it's nice to some of these things don't have to be emotional. They're just fact-finding missions. So not everything has to be face-to-face. It can be done by email. There's a lot of literature that's written from reliable sources, trustworthy sources. That's the first question. What's trustworthy and what's not? That's always a big issue now that we have thousands of avenues that we can ask questions. Even artificial intelligence nowadays can answer these questions for you, maybe not accurately and not specific to you. But anyway, so that's the other thing. But yeah, so that's an excellent way of thinking about it. Absolutely. Also the tension, besides timing and how much time, is also the permanence. Right. Once you take off the foreskin, you ain't going to be putting it back on. Yeah. So it's like, you feel it's kind of like a life and death decision. If you're going to make it, that you better make it right, because you ain't going to get a redo if you have it removed. If you decide to leave it on, you could do it days, weeks, months later. That's potentially right there for you. So there's a little room to think. Right. Yeah. So yeah.
So I think that's a good first step is with healthy skepticism is figuring out, do I have to make a decision right now?
That's right.
Is it Is it going to cost me more? There's a lot of different ways you would make that, or things you would make that decision based on. Is it going to cost me more? Is it reversible? Are there negative implications if I don't make a decision right now, or if I wait? Is it going to cause harm if I wait?
Right.
And if the answer to all of those questions, or some of those questions, is no, you might have some time to
That's right.
do some other things.
That's right.
So let's say, I've had this conversation with my pediatrician, but I'm still a little bit unsure. So one of the things that you mentioned is individual research, right? There, like we said before, there's a plethora, including our podcast, by the way, of people with opinions,
That's
right?
Thousands.
You can find thousands, millions of opinions online.
Yes.
People can represent themselves as reputable sources. They can represent themselves to be experts on a topic or knowledgeable about a subject. But it's really important when you're making healthcare decisions to pick truly verified sources, not just blue checkmark sources. But
it'd be ideal. That's an ideal world, because I think you're a lot of science based. I think that you look very, very factually based information. Because I've known you for a few years. A lot of people just want to hear an opinion that matches theirs. The confirmation bias.
Yeah.
Right. I've read that the penis loses sensitivity, and if anybody tells me differently, I'm not so sure. So I want to find somebody who kind of agrees with me, or doesn't make me feel foolish for saying those statements.
Sure.
And nobody should make you feel foolish, by the way. So that's important to say that. And I think it's important for the person on the other side of the table from you to not have ego, in the process. I'm the one that sat with you. I know the best. You've listened to me for all the other kids. I've been with your family for so many years. And the answer is that's ego. It doesn't matter that if you have questions now, you didn't have questions before.
Yeah.
Now is what's important.
Right. Absolutely. I think that's what a great point to pick up, or to bring out, which is that, a healthy skepticism that's going to end up in good decision making, involves being aware of confirmation bias, right?
Yes, right.
And then also, if you're going to offer advice to someone on what to do about something, being aware of how your ego comes into play.
Yep.
And even I think as a patient, being aware that you, Dr. Tadros, are a wonderful doctor that is very self-aware and has been doing this a very long time, and that there is a propensity for ego to come into play. So you will purposefully negate that when you're giving someone advice. But not everybody will.
Well, I'm not perfect even after 30 years of doing this. We're pretending I'm a pediatrician in this case. Yes. And I can tell. I feel kind of sometimes hurt, not always insulted, but hurt. But then I recognize, people have a lot of people talking in their ear. Yeah. I'm only one voice that they're listening to or reading from. Sure. So I have to recognize, and that's why it's important for me to understand kind of where does a question come from.
Yeah.
It's like, what is concerned? Well, I've read or I've heard, or my uncle or my grandfather or my uncle who's an OB, or all that stuff matters because it's generated questions in your head, and it's for me to understand what who I'm quote unquote talking to. It's not just you, but all the history of people and the things that people have talked to you, you've spoken to, and all the things that you've read make a difference in terms of
how you sort of arrived at your questions and your point of view.
Right. Even if I may have the same answer, but how I present it to you.
Yeah,
that's right.
Absolutely. Mm-hmm. That's interesting. Yeah, that human part of the communication is, kind of appealing to where that person is coming from as well. Okay, so so back to my decision about circumcision. Let's assume it's not time sensitive. It's not going to cost me more. I've got a little while to think about it. I could do some individual research. We've got some really great resources out there. Mayo Clinic is very reputable. You've got some other favorites.
They all tend to speak, if they're the Mayo Clinic, the Harvards, the Cleveland Clinics, the University of California, San Francisco, UCLA, all these big universities and big hospital systems, Kaiser Permanente, all these tend to speak the same language and tend to give the same advice. It tends to be, and this is where people sometimes have an issue with quote unquote organized medicine. Yeah. The MDs and the DOs. Yeah. Allopaths are MDs, DOs are osteopaths. They both practice medicine like I do, and are surgeons, etc. So quote unquote organized medicine tends to speak the same language. Not always. We have people that don't, and so this is what sometimes people say. I've heard this from three other urologists or three other pediatricians. I'm looking for something else, or somebody to entertain my back and forth, my negotiating. Some people are quote unquote negotiating.
Discourse.
They're negotiating with themselves. They're kind of speaking out loud, and sometimes physicians don't quote unquote have time for that.
Sure.
They just want to say, let's make a decision. It's that easy. It's yes or no. It's not that hard for them, but they've done it hundreds of thousands of times. They've made those conversations, but it's the first time, maybe the only time for you to make this conversation or ask these questions. So I think that's out of respect for the person who's developing, the mom who's developing in front of us, the mom and dad who are developing as parents. I think it's important to recognize that even though somebody may have delivered thousands of babies or done hundreds of thousands of circumcisions over decades, this is your baby, your very first baby, and it's scary. It's difficult. Yeah.
Absolutely. Okay, so that kind of brings me to the next thing, which is second opinions. So, and this is not just, getting a second physician's opinion. Sometimes, like you were saying, you might want to ask another trusted individual in your life what their opinion is, other moms, family members, what their experience has been like, and then bring that to your doctor or incorporate it into a conversation that you have with another doctor. I think sometimes there is hesitancy. I'm definitely this kind of person. I want everybody to like me and to think that I'm agreeable and dependable and reliable and all of those things. So if I have an established relationship with the physician, I would struggle to feel like it's okay for me to go get a second opinion, that the doctor might think that I'm like going behind their back or something. So how would you tell people to think about that? Or how would you tell me as a new mom to think about that?
The great thing as a generalist, as an internist or quote unquote pediatrician, or as I play one.
Whatever you are right now. You play one on TV.
Is that I'm a generalist. I'm not the specialist. So I have no problems. 99.9% of the time, I have no problems people seeking a specialist for an opinion about something I said or thought about or wasn't sure about. So that's the first thing. So I don't have ego in it because I've not had ego in it for decades because I always learn from all the specialists that my patients go to see and I get the information back and consultation notes, etc. So I always learn. And specialists are sometimes as varied as sometimes anybody else out there. A lot of them, MDs and DOs that are specialists tend to talk the same talk, walk the same walk. There's some sometimes small deviations in terms of what they'll say from each other, but they tend to say the similar things. Small numbers of people, and those people stand out, not outliers, but stand out to patients who say, I wanted to decide about how I can treat my coronavirus disease without X, Y, and Z. Can I do X, P, D, Q? And none of the doctors here would listen to me or nurse practitioners, so I'm going to go somewhere else or read or text somebody else. And so they are looking for another opinion, another that's not the party, quote unquote, party line. And that's important to recognize that. We've certainly in the last few years, over many years, but certainly the last 3 years during the pandemic, we've seen a lot of being able to voice and being supported to voice your dissent with the quote unquote party line or traditional medicine, medical opinions.
Yeah, I think, and that's kind of a blessing and a curse, right?
It is.
Because again, there's so much information and so many opinions. It was kind of useful to have one consistent messaging.
It was much easier in a lot of ways.
Yeah, exactly. For us all to think that,
even if it came out to a bad outcome, all of us had the same risk, and we all kind of be in the same boat, and we were kind of all rowing the similar way, and it was much more comforting. But yes, that's now it's kind of it feels like mayhem in a lot of ways. Yes.
Absolutely, and I definitely feel like parenting decisions, especially, are feeling that way, where the stakes are so high, and that you kind of feel a pressure to become an expert in things that I have no training on, and that the decisions all have to be up to me. So
I want to modify that because sometimes we should have started this at the beginning. The quote unquote research, the word research, do your own research, which is what we hear a lot of different things. Yeah. It's a mantra. It sounds good. It is extremely dangerous. Even whenever for instance, during the pandemic, as a general internist, as I read the literature about what was coming out, I recognized, even though I like to read about this stuff and I've dealt with other virus issues, I'm not a specialist in infectious disease. I'm not a virologist, but that I recognized even my reading the literature and my listening to experts, I was still not as well informed about all the nuances. Maybe the big picture I could understand, but some of the nuances and so when somebody who has no training in medicine, no training in virology, no training in infectious disease, says they do quote unquote do their own research after a few days or a few weeks, they're not even close to understanding the topic or the literature or the validity of the literature, because a lot of crap is published. Right. Everything from newspapers to big journals like the ones I read. So that's the problem we run into. "Quote unquote, do your own research." Understand more, find more questions, ask more people. Does not really mean that you have an answer that goes against a professional who's done it for a living for years. So that's the problem we run into. I'm not equivalent to a virologist. I'm not equivalent to an infectious disease specialist. I'm not equivalent to a research PhD and stuff like that. So we got to be careful about how we use do your own research and stuff like that. Yeah.
And that kind of comes back to like what the purpose are of a lot of these recommendations and vaccine schedules and things like that, is that those are all of the wealth of knowledge, the entire body of work of these fields has been distilled down into a recommendation that is in effort to get the best outcomes for the highest number of people. Can you talk a little bit about how those recommendations are arrived at and why you, for the most part, want to follow them as a physician?
Yeah, and people, and we'll just say it out loud, a lot of people, especially recently, like I mentioned, don't trust the government. That includes the CDC, the NIH. They don't trust big pharmacy companies, big pharma, Pfizer and all the other ones, and Merck and other ones. They don't trust sometimes a physician who may have a vested interest, a financial interest in recommending certain things, or who's employed, or the physician's employed by a big corporation or big medical group. So this is, or somebody who's paid to talk, or somebody who has a book out that's a specialist and an expert, but has a book out and wants to quote unquote sell books. Yeah. So this is part of the problems. Then who do you turn to? Sure. This is when you end up turning to your relatives, your friends, your uncle, all these people and stuff like that, because you've just eliminated all the real specialists that have done this for a living. The big pharma that's developed stuff over decades, platforms, for immunization, and all the governmental bodies that's what they do for a living, et cetera. So now we've eliminated everybody. So now it's everybody and their mother is equivalent to all the other people that are just specialists, because now we think that they're all on the same plane, and they're not. They're not. So that's one thing. But by the same token, we got to understand that people are worried that there are lots of other people who are supposed to quote unquote look out for the best interests have other motivations, hidden motivations, and so that's some of the. And I think as an extremely, I'm glad you brought this up. I think this is an extremely big problem that we've had in the United States over a long time, is that people that we're supposed to trust that have lied and cheated about the research, or have left government and gone to work for much more money for private industry, or own a lab, and therefore that's they ordering lab tests and sending you to that lab. All these people have broken the trust of the American public in a variety of ways, not just in medical care, but also in finances with Enron and a bunch of other things. So I think I think this is the fallout of years and years and years of bad actions by a few small bad actors, but it's really painted everybody with the same brush. Yeah. So that's the first thing. But whenever it comes to making recommendations about immunizations and immunization schedules, I won't talk about the coronavirus specifically because it was an emergency use and stuff like that. Sure. But in general, the stuff that we've all used, almost all of us have had, that's within earshot of this podcast, measles, mumps, rubella, MMR, TDP, tetanus, diphtheria, acellular pertussis, measles, mumps, rubella, and polio, chickenpox vaccine, and for older folks, the shingles vaccine, hepatitis A and B vaccines against hepatitis A. herpes simplex virus (HSV) vaccinations. I'm sorry, HPV. Not herpes.
Yeah.
We don't have
Right.
anything against herpes. Sorry,
Right.
sorry. I know it was exciting for a second, but HPV.
Disinformation. We're getting flagged
That's
right now.
Human papilloma virus, which increases the risk of oral cancers, rectal cancers, vaginal cancers,
Yeah.
depending where the HPV virus lands. So we have these unbelievably fantastic vaccines. I'm not even talking about typhus and some of the other quote unquote tropical and zoonotic diseases, even vaccinations for our animals and pets, stuff like that. It's unbelievable the stuff that's happened over the last 150 years in terms of vaccinations. Those and it's not that they're perfect. It's not that they cover the disease perfectly. It's not that they don't have side effects for a select number of people. But on average, when you're doing population immunization for thousands and millions of people, on average, we're better off that we have polio vaccinations and HPV and measles, mumps, rubella, and polio and tetanus. Lockjaw. How many lockjaw cases are there in the United States per year? 6, maybe. This is rabies. We're so blessed to have these and there's oftentimes universities and big pharma that developed and produced and dispensed them to us. So I think on average, this is not every single person, but on average, we're way ahead because of vaccinations.
Yeah.
We're looking for vaccines against cancers. We're all these things. These are this is. I think it's important to understand. We're not dumping vaccines anytime soon.
Yeah.
The mRNA vaccines that were developed, that were first come out for human use, they've been developed over many years, by the way, but first were implemented under the Emergency Use Act during the pandemic. It's different platform than what we're used to for how they develop most other vaccines. And I can see why people are scared. They think it just was developed just as an urgent thing. But the platform, how we use mRNA to make vaccines, has been around for quite a while. But in large multi-nation use, it's only in the last 3 years or so. So that's the scary stuff for people. I don't blame them. I think we missed, and I wrote a blog about this, I think we missed an enormous opportunity to educate the American public about all sorts of things, including health care, their own health, and vaccines also. Including the understanding this virus as well as other viruses that infect us. Yeah.
So to kind of bring this back to, our case here, recommendations are based on population level data, correct?
Yeah, thousands, if not hundreds of thousands.
Hundreds of thousands, millions
of people. Right.
So there's this tension between making decisions for individuals based on recommendations that are born out of population level data. So I think it's important to keep that in consideration, especially as a patient, that it's relevant. It is okay. It's permissible for you to ask questions.
I want them. I love it when my patients ask questions.
Yeah.
I recognize but I also have a personality and ran a practice that allowed time for these things. Most physicians who have to cover their overhead, et cetera, and employ people and be in practice next week don't have the time to sit down and have a back and forth like we're doing in this like equivalent of what you'd have in a podcast, for instance.
Sure.
If you brought in a couple of experts that disagree with each other.
Yeah. Okay, so I think that ultimately then, the way that I would make my decision about whether or not and when to circumcise my child would come down to the same formula that you use to make a lot of important decisions in life, right?
That's right.
Which is that I'm going to collect the best data that I can. I'm going to understand that there's pros and cons to every single choice that I make.
Well, you start out with your value system, which includes your social network and your family history of what's happened in your family. All that stuff. Some people want to go against their family. It goes against what their society tells them. But a lot of people tend to follow it.
Yeah.
But then you get the data that you think is valid.
Right. And I weigh my options, right? I consider the pros and cons of both. And I have to consider that there's unknowns, right? There are lots and lots of unknown variables. Some some choices have fewer unknowns, and the choices are more clear cut and straightforward, and those are the easy choices to make. And some things there are a lot more unknowns.
Well, it's not just unknowns, but unknown unknowns that you don't
Yeah,
even
so
know.
you don't even know that
You don't
you
even
don't
know
know.
to ask
Yeah.
the question about why something's unknown.
Exactly.
I mean, you're even further in the dark than you ever imagined. But
Right.
yes, that's correct.
Yeah. But then I think the rest of it, I have to make my decision with, confidence, and then some, level of giving myself permission to make the choice and then let it be, right?
Yeah, that's the healthiest. That's the healthiest
So-
mental. That's
right.
the healthiest mental. I call it straddling the fence.
Yeah.
When you're straddling the fence, when you know you're on one side of the fence or the other, it's fairly
It's
easy.
easy.
It's
Yeah.
relatively easy.
Yeah.
Sometimes society doesn't like you to be on the other side of the fence from them, but that's another discussion. But the quickie answer is, whenever you're straddling the fence, should I, shouldn't I? Especially for somebody else, where
Yeah.
you may harm somebody else. Somebody else may be harmed by your decision or indecision
Right.
or lack and stuff. That's enormous weight, an enormous burden. Yeah.
Right. Absolutely. But I mean, I think that I so far, that's kind of how I've approached it, right? Like I've relied on the people whose opinions I value.
That's right.
I've taken good partners in the medical field. I've done some research of my own. I've taken the appropriate time to make my decision, and then ultimately I've made a choice, and I have
right.
made my choice and
Yep.
I accept whatever is going to come next.
And hopefully you're not in isolation. Hopefully you have your like you make a choice with your husband in this.
Oh
one
yeah,
case, for instance.
absolutely, yeah.
Because
For
a
sure.
lot of people feel, well, sometimes because they're maybe more medically interested or medically knowledgeable, they feel like everybody's looking to them to make the decision,
Yeah.
or they're the mom,
Right, yeah,
which
yeah,
tends
yeah.
to make the decision for the whole household. By the way, for
sure.
healthcare, not just
Yeah.
your just not your
And
son.
then, of course, in some, in some families or partnerships or relationships, one person may be more interested
right.
in it than the other, or have a
right.
stronger opinion than the other
Right.
person. So, of course, that's a dynamic to work out too when you're making these big, important decisions about things. But ultimately, that's kind of like a model that should set you up well for
That's
it.
right.
Let's pivot for a second
Sure.
to a decision about a treatment for an existing disease.
Okay.
So let's say you're my primary care physician, and
Yes.
I've just gotten a diagnosis. You sent me to get a biopsy for something that was scary looking. We've just gotten a diagnosis. It is cancerous. There is treatment that needs to happen.
Yes.
How would you encourage me to move forward from there if time is of the essence?
Yeah. So, first of all, I'm always questioning. My personality is to question everything.
Yeah.
Question: was it the right patient? Was it the right biopsy? Is it the right pathology? Is it the right answer? Does it make sense? And every good physician will do this. Just because we send you off to a radiologist who does an interventional radiology procedure and finds a lesion with a needle and gets a couple of core samples or aspirates something, sends it off to pathology, comes back as cancer. I don't always automatically, 98% of the time, 99.9% of the time, it's accurate, and that's what we're going to
Sure.
work off of. A small percentage of the time, it's not. It doesn't match what we thought.
And so you have a healthy skepticism
Right, I have a
of
healthy
what the
skepticism.
recommendation is.
That's right.
Okay,
So
love
I-
it.
So that's the first thing. So yeah, if something comes back and doesn't make sense to me for the picture that I believe that I'm looking at, I have to. Sometimes you pick up the phone, you call the interventional radiologist, said, hey, did you think that you got the lesion? Call the pathologist and stuff like that. Oncologists will do this all the time, by the way. They do rounds where they actually will talk about difficult cases and review everything from square one, and which is a healthy way of approaching anything that's questionable, difficult,
Yeah.
troublesome. Anyway, so that's the first thing. So from there, then I want to make sure that I understand the patient's I hopefully have the patient in front of me. It's not virtual. I just grind my teeth about virtual whenever it comes to these difficult decisions, and whenever you're talking about something new or something, a new patient or a new diagnosis or a difficult diagnosis, quote unquote bad diagnosis. So I want somebody in front of me, and I need to know the person's values. I need to know the person's education, all sorts of stuff. So if they're an engineer, or if they're an 18-year-old that's just out of high school, I may talk to them differently to get them the same information, to make sure that they have this an understanding why I believe that they can make a wise choice for themselves. the kind of the ethics is that we believe that everybody makes the best choice for themselves with the available knowledge that they have.
Right.
Not always true.
Yeah.
Obviously, people have addictions. They make terrible choices for themselves for now and the future and stuff like that. So we have, and people under stress and people under financial stress, and they sometimes will pick stuff that that may not make sense if they had more money or et cetera. Not always more information is important. Sometimes more information is like, well, more information. Sometimes it's we need to step back and we need to understand the context of which the patient's receiving the information. Did you just get bad news and their heads is spinning and I'm trying to talk about options? Maybe not the best time to talk about options. Should they have somebody else sitting in with them who has their best interest in mind, a mother, father, brother, sister, minister, somebody else, wife, husband, mom, dad, sitting in with them, to another set of ears, another set of eyes, so that people can the patient can ask questions after they leave the office to somebody else who has sat in actually listened to the whole conversation and watched all the handouts, etc. So all these things matter to me. The next thing is, some people, I think I'm just throwing a pebble into the pond. You have prostate cancer. Well, it's going to be fine. It's in 2 out of your 12 biopsies, the Gleason score is low. You're otherwise healthy. You're going to do very well no matter where I send you and whichever urologist. But for them, it feels like I threw a boulder into their pond because they've never had cancer. They exercise every day and they eat vegetables all the time. They thought they could avoid all this crap. So for them, I threw a boulder and destroyed their placid pond. Whereas I thought it was like, geez, this is the best diagnosis. This is the best diagnosis and prognosis I could give you. I've had people.
Why aren't you happy and thanking me?
I'm like, hey, this is good news and stuff like that. So I have to recognize that I may not be talking to a person with my value system or my perspective. So that's the next thing. The next thing is I want to know if I'm going to 99% of the time I'm going to send them to a specialist, for instance. I want to know, if they already have a specialist in themselves or the family, if it's a urologist, gynecologist, oncologist, whatever, if somebody else seen a specialist that they like, already they have a relationship with, whether it's the patient themselves or their relatives. Next is what medical system they want to be involved in. In St. Louis, we have a few big medical systems, SSM, BJC, Mercy, St. Luke's. So I want to know which medical system they want to belong to, because I want to keep everything kind of under one roof.
Yeah.
I want to keep everything under one roof. Even though electronic medical records are supposed to talk to each other between medical systems, they do, is that sometimes it's harder to get a little bit of data. The workflow for a physician sometimes is interrupted if you have to get stuff from another system, another medical group, another medical system. So that's the next thing. How close? Some people have a hard time getting to appointments and getting to stuff. So how close do they want to be? Do they want to go down to the big university down in the city where it's harder to park and you have to work further? Or would you rather have a hospital closer to home, may not have the university expertise, but you can get there and it's more comfortable, it's more comforting. Your loved ones can drive with you and stuff like that. Mm-hmm. All these things matter.
Right.
And sometimes I will say, if I think that they're making a choice, and almost all these patients are patients I've known for years, if I think that they're making a choice that may have consequences near term and especially long term that they may not be able to see, they may not be able to project, but I can project because of my history with them and my history with other patients, that if they have esophageal cancer, for instance, and you may not want to be in a small community hospital, 30 miles out of St. Louis. You may want to go to the big guys and gals because it's a difficult cancer, it's a difficult surgery, it's a difficult prognosis, a difficult recovery, and stuff like that. So instead of me trying to send them somewhere where it's maybe more comfortable to them because that's what they know. And then later, whenever things go bad, and 6 months, a year, 2 years, then I send them to the university. I sometimes rather have them start off in the university right away. Yeah. So that's just the way I kind of ping pong things in my head.
Yeah. So I kind of, to recap that, I think what I'm getting for you is that a good doctor is going to have healthy skepticism on your behalf, right?
Sure.
So I heard you say some really interesting things. So that one, when you are helping a patient make a decision or come up with the best course of action to, for whatever their treatment should be, you're thinking about does the diagnosis make sense? Does the
Right.
prognosis make sense? Is
Right.
it the right, do we have all of the right information here? Is it all accurate?
Right.
That's a really important first question.
Yes, basic. Yeah, some
Yeah.
people would skip ahead to the treatment and the people you're
Yeah.
sending to, and I'm sometimes I'm like, hey, you know,
Yeah.
this came back much less aggressive than I expected, or didn't pick up a cancer that we believe is still there.
Right.
So let's let me, before I go down that road, let me back up and ask the people who worked with you already.
Sure.
About their opinion or about what they see.
So next I heard you talking about, sort of the conditions in which this patient is having to make this choice,
That's right.
right?
Mm-hmm.
So, is it the best time, are they in shock? Is it the best time for
That's
them
right.
to be making the choice?
That's right.
Should they have someone else sit with them, or are the right people present to help make that good choice?
Yeah.
And then also, the boulder versus pebble sort of metaphor here,
Sure.
that you guys have different perspectives, right?
That's right.
A good doctor will see that I have a different perspective than my patient does. I've
Right.
seen hundreds of these cases. I think I'm presenting them with, the best possible outcome, the
Right.
best possible news. But to them, it's earth shattering.
That's
It's
right.
cancer. It's very scary.
That's right.
So, helping them to sort of navigate that as well too, and then of course taking into consideration cost, medical systems, the distance to where they might get treatment,
Yep.
or the need for specific expertise to get the best treatment.
Mm-hmm.
So all of that
Mm-hmm.
is I just think it's awesome to have access to your doctor brain, of course, again, to understand
Yeah.
the different steps that you're
you do
thinking
this-
through, and a lot of good doctors are thinking through to help you make a good choice.
And I mean, I'm blessed that I trained in St. Louis, so I kind of, since '86, I kind of grew up most of my life in St. Louis, so I kind of know the system, et cetera. And it is important. I remind people you can go to 3 specialists that don't communicate with each other, and you'll still get bad care because everybody's got their little silos and they
Yeah.
don't communicate. And even though they have their own expertise is fantastic. So it's important to kind of be able to, and sometimes it's kind of fallen on the patient who's sick, unfortunately, or their family or loved ones to kind of coordinate some of this stuff, to kind of to bring the troops around to talk to each other, get the data transferred more easily and stuff like that. I know physicians have office administrative people that kind of try to lay down the path for them, so everything's present before the office visit or at the time of the office visit. A lot of times it doesn't happen or doesn't happen fast enough.
Yeah. Okay, so to kind of wrap up here, again, we wanted to encourage people to, fall somewhere on this spectrum between tinfoil hat society and being skeptical of absolutely everything, and falling into this trap of feeling like you have to become your own expert, which we
Right.
discussed is not. It's kind of a fallacy. It is impossible for you to know as much and know the nuances.
I mean, so
as
some
well.
people like that they are ignorant of the facts. Ignorant being a positive thing means not knowing.
Yeah.
Not because then their mind is open to all possibilities and potentials.
Sure.
Whereas the physician, they're looking at whomever, the government person, is very narrow in their focus and
Yeah.
already had their mind made up, 20 years ago, and they just repeat the same thing for every single person.
Exactly.
So but we have to be, and so. For me, the way I see it for patients is that they force me to educate myself to make sure if I am going to say something that I know that it's the most recent data
Right.
and the most recent information and why I would say this instead of something else. And if somebody else brings up, once again, I've learned, it's been years that I've learned not to put my ego. If somebody brings up something from the internet, traditionally physicians, are like, I don't want to,
Yeah,
the internet.
right.
For me to say the internet knows the totality of human knowledge. It
Yeah.
knows more, quote unquote, knows more than I do. But what I do better than the internet is that I'm specific to you.
Yeah.
I know your values, or you're sitting in front of me and stuff like that. So just doing a search, and this is where AI, artificial intelligence, comes in. Doing a search is not enough.
Right.
So it has to be specific to you in this state, in this value system, et cetera,
Yeah.
with your family issues, all the things, your emotions,
Right.
and stuff like that. So that's what I kind of enjoy. That's the tweak. That's the piece that I've enjoyed for years.
Yeah. So again, encouraging people to fall somewhere along,
Mm-hmm.
more in the middle of that spectrum between like totally distrusting and to blindly trusting, right?
Right.
We don't want to encourage either
No.
extreme. It's
Right.
it's healthy, a healthy level of skepticism,
Right.
a healthy level of critical analysis to understand what your choices are,
Right.
how much
Right.
time you have.
Right.
to make a decision. Your goal is to make decisions under the best possible circumstances, right?
That's correct.
So, I mean, personally, as a patient, I find that to be a hopeful outcome for things. I mean, it's a framework that I can think about these, healthcare decisions. I'm going to have to keep making healthcare decisions for my son until he's 18 years old. Well, I mean, in cooperation with him when he's old enough to consider it as well, too. But that's a lot of choices to have to make. And there are certainly consequences to all those choices. So I'm glad to have heard your perspective as a physician, the things that you take into consideration.
Sure.
And also for us to have this opportunity to sort of talk through, the best way to harness my own healthy skepticism to make those good choices.
I know you love to read, and when we sit and talk, because I'm not your physician, I'm not your child's physician, we can sit and talk about stuff. It's leisurely. The typical person who's running an office or people that are running an office recognize that there are a lot of worried moms, new moms, and stuff like that, and they recognize that 98% of them are going to do what's traditionally done in terms of immunizations or whatever it is.
Sure.
And they'll believe in stuff like that. The small percentage of people say, I'm not sure, I don't know, I don't trust. And that's those are the people that should slow down and have a positive experience with their lovely new mom.
And absolutely, as a patient, it is your right to ask these questions, to understand the treatments, to understand what the options are. There's nothing, we've talked about power imbalance and, relationship dynamics before. There's nothing healthy about, feeling like you are pushed into a corner that you have to make a snap decision that you're not comfortable with.
Right.
So certainly we want to empower people with the tools to make their own choices and to ask good questions.
It's hard to say whenever you're fasting and you come in, or you're paid your copay and you've been sitting in the room for a half hour, and somebody comes in and all of a sudden you don't want to be there, you want to ask more questions, but things are already going ahead to say, thanks, but no thanks. I'll make another appointment, or let me, stuff. So it's very hard. Hopefully things don't reach that point where everybody's made a choice and stuff like that, and they've made an appointment. But hopefully that something has been done in advance to help ease your concerns or answer your questions, stuff like that. But yes, So it is hard. It is hard. It's hard to, whether you're doing it at a used car dealership or in your doctor's office, and say thanks, but no, I know we're 80% of the way there, but now I'm not so sure. Let me back out and politely step away.
Sure. All right, guys. So that's another episode of the Not Your Doc podcast. Again, we want to encourage people to give us feedback on how we're doing. Let us know if you have any questions. notyourdocpod@gmail.com. You can shoot us an email. You can listen to the pod, of course, on Spotify and YouTube. You can check us out on our website, notyourdoc.com. Seth has put together an amazing website for us. With bios, all of Dr. Tadros's blog posts, the musings of that mind of his.
I think it's pretty good.
It is pretty good.
Pretty good.
It's
pretty amazing.
Good. If you do say so, yes,
I got nowhere to go now. Because it's already amazing.
It is already amazing.
Maxed out.
It's, of course, got all of our podcast episodes on it. Of course, more great stuff to come. We're going to have more experts. We're going to talk about, all kinds of new stuff going forward in this season. So
every time we're here, I have more questions and more podcasts for those questions. So
absolutely. All right, guys. Well, thanks again. I'm your host, Vanessa, signing off for Seth, the producer, and Dr. Charles Tadros, Mr. Not Your Doc himself.
Thank you, everybody.
See you next time.
Bye-bye. This previous podcast represents my opinions and the opinions of my guests. This is not medical advice, and I'm not establishing a physician-patient relationship with any listener. The content here should not be taken as medical advice. The content here is for informational purposes only, and because each patient is so unique, please consult your healthcare professional for any medical questions that you may have.